Welcome to the Aging with Options Show. I'm Chris McCutcheon. Thank you for joining us today. The Aging with Options Show is Louisville's only weekly radio program about seniors and for seniors and their loved ones. The first set of baby boomers turned 65 this past January. Since then, more than 10,000 baby boomers turn 65 every day, and that will continue to happen for the next 19 years. Our passion by way of this radio broadcast is to provide interesting, relevant content for seniors and their families in the Louisville area. On this program, we discuss a variety of topics facing today's seniors, topics such as health, senior living, long-term care, aging in place, local senior events, and innovative products and services for seniors. One such innovation is the subject of our discussion today, specifically how options for the delivery of primary care services are evolving in our community. Dr. Mike Benfield is my guest today. Dr. Benfield is a graduate of East Carolina School of Medicine. He completed his residency in pediatrics and internal medicine at the University of Louisville. Dr. Benfield is also the president and CEO of MD2U, a company he founded here in Louisville in 2004 to provide primary care treatment to patients who are homebound or home limited. Dr. Benfield, thank you for joining us.
Oh, thank you for having me. Yeah. Pleasure to be here.
Good. After graduating or completing your residency, rather, in internal medicine and pediatrics here in Louisville, instead of beginning your medical career by joining an office-based practice and setting up your shingle and getting started, instead you began a business rather than just going out and starting the practice of medicine with a group. How did you come to the decision to start MD2U?
Well, Chris, really what I did was start a medical practice that was just different from other medical practices that were typical. There were some that were doing what we do, but not very many. And throughout my residency training, I was always looking for my niche, where I fit in medicine. And I knew that I didn't fit in really in working in the hospital setting. I didn't really feel like I wanted to get involved in working my way up through an established practice. I wanted to have my own practice. And I started looking more and more at what kind of niche I could fill. And as I was doing my residency training, we had once a week we had residence clinic where patients would come and they would be assigned to us, and we had our attending physician there. And we took care of these patients in that particular clinic. And we had a medium-sized waiting room, and many of those patients that would come to that waiting room were in wheelchairs or on stretchers. And I started to notice this happening more and more, and most of these patients that were in that situation were seniors. And as I would leave my clinic that week, I would walk over to the hospital and do rounds there, and I would see 3 or 4, ambulance services set up there to take patients back home. So that started the wheels turning, and I had a patient who had something called ALS, or Lou Gehrig's disease, most people know it as. It's a progressive neurologic disease, and she would come into our clinic every 3 months by ambulance alone and lay there in that waiting room on a stretcher, not already paralyzed to where she really unable to cover herself. We would have to help her with those kinds of things. And really, she was only there to do one thing, and that was to get her medications refilled, because we wouldn't refill her medications unless she came in to see us. And that's how many practices operate. And it's understandable that people don't refill medications without seeing their patients. Once I found that out, I started thinking, this person, this was so wrong in many ways. There's pain and suffering for this lady to get there, loss of human dignity. And then, the third thing was the tremendous cost of transport from home to our practice and then back home again. And so that's when I think there's a real need to be able to provide this kind of care in the home and bring a primary care practice into people's homes and serve them that way.
Interesting. So that gave rise to the idea of MD2U, which you started in 2004. Tell us, Dr. Benfield, who is a candidate for your services?
Right. Well, our patients, we have this term we use that's called home limited. There's also a term called homebound. And so if you're homebound, doesn't mean that you're bedbound. It just means that you have difficulty getting out of your home, and most of your time, 95% of your time is spent in the home. Those people that are homebound, they can go out maybe to church or to get their medications. Some everyday just things like that. And usually, almost always, someone has to take them. Then there's another term we use called home limited, and those people are not necessarily homebound by that definition, but really have great difficulty in getting out of their home. They can, but it is difficult. They have to rely on someone else to always do that for them. And then when they can't get that done, then they lack access to all the services that they need. So a person who cannot make and keep a medical appointment on their own is eligible for our services. And really what that means is if you can't call yourself and give the information to make an appointment, get in your car, drive yourself to the appointment, give a reasonable history, receive instructions, go back home and implement those instructions, then we feel like we are able to, we can see those patients and really make an impact in their lives. And those are the people that we typically see.
Is it up to the patient to make the determination if they are homebound or home limited? Is that, do they have the ability to determine that on their own, or is there a more official way of designating that?
No, and that's why we give that rule of thumb, really. If they know that they can't make and keep appointments on their own, they should, think about having a service like ours. But once we see them, we can make that determination with them and help them understand whether or not they would qualify for our services once we see them, or after having a conversation with them on the phone through our intake department.
Okay, so someone who says, "Well, it'd just be more convenient for the doctor to come to my home."
Yeah, that's right. We are not the fit for that person. So there are many people who, of course, would think this would be a great service and be very convenient for them not to have to get out of their bed when they don't feel well and go into a doctor's office. But unfortunately, the way that insurance services are and the way that those payments are made, we're not able to serve those people.
Your criteria have to be a little bit different than that, right?
That's correct.
Okay. So how does someone become a patient of your practice?
Well, to become a patient of our practice, really, you just need to give us a call. It's 327-9100 here in this area, and we'll take some information from you, and we'll set an appointment. We'll almost always try to see patients within 48 hours that they call, and we're certainly no longer than 5 days.
Okay, so just calling the office and setting up appointments just like they're used to doing with their office-based primary care physician.
That's correct.
Okay. Does a patient that wants to be seen by your practitioners, do they have to get approval from their current primary care physician? Are they involved in that decision-making process with them?
Sometimes they are, and we get patients referred to us from many sources, home health agencies, nurses, and therapists who recognize patients that need this kind of service, who are in their homes already. We get referrals from hospitals and from discharge planners. We get referrals also from primary care physicians who have patients that they haven't seen in a long time, or who continue to cancel appointments because they're unable to make and keep that appointment. But most of the time when we get a referral, we start seeing that patient, and if we can get them to a point where they can make and keep appointments on their own, we refer them back to their previous primary care physician. If not, we continue to see that patient until they're no longer with our service. Either they go into a skilled nursing facility, or they pass away, or some other thing changes in their life.
So tell us about how your services are delivered. Who's providing care to patients in their home and within your practice?
Okay, well, I can tell you, sort of the three main things that I always tell people. And one is to make sure that what people really know is we're a house call practice, but it's more than that. It's a primary care practice that makes house calls. And every question you might ask yourself really relates back to that particular point. And the second thing that I always make sure people understand about our practice is that we do take insurance. 95% of our patients have Medicare as their primary insurance. And the third thing is, I always make sure that I tell people that we're a full service practice, meaning that patients can get blood tests, urine tests, x-rays, EKGs, ultrasounds, even echocardiograms, all done in their home. We don't do that, and this will answer that question about our model. Is we outsource, mobile x-ray, phlebotomy, lab work, home health nursing, and therapy. What our practice is set up to do is to provide primary care in the home. And we do that by using a nurse practitioner-based model, because we have found through our experience over 7 years and more than 100,000 house calls that the nurse practitioner is best trained and educated and to provide service to these patients that are homebound or home limited. And most of these patients have multiple chronic diseases, not just 1 or 2, but 4, 5, 6 that are typical: COPD, which is emphysema, CHF, coronary artery disease, hypertension, and diabetes. And nurse practitioners are trained specifically to be educators to patients so that they can manage these diseases better, and so that they can take better care of themselves and have a better quality and more quantity of life.
Very interesting. My guest in the studio is Dr. Mike Benfield, President and CEO of MD2U, a primary care practice that makes house calls to the homebound and home limited. We'll take a quick break and be back with Dr. Benfield and more topics of interest to seniors in the Louisville area right after these messages. You're listening to Aging with Options on 970 WGTK.